This recording covers the heart. The heart is a hollow, cone-shaped, four-chambered muscular organ, weighs about 11 ounces and is about the size of a closed or clenched fist, about 5 inches long and 3.5 inches wide. Not very big for the big job it has. If the heart stops beating, life stops also. That's a big responsible for this tiny organ. The heart is located in the mediastinum. It is placed obliquely, with 2/3 of it lying on the left of midline. The right border lies or rests on the diaphragm. Think of it as an ice cream cone lying on its side. The pointed end of the heart or cone is called the apex, which is directed inferiorly and to the left. The wide portion of the heart is called the base. It lies opposite to the apex, and therefore it lies superior and to the right. The heart consists of 3 layers: the pericardium, myocardium, and endocardium. The pericardium. The pericardium is a serous membrane, therefore it must have 2 layers separated by a cavity. The outer layer is the parietal pericardium. The inner layer, which adheres tightly to the heart, is called the visceral pericardium or epicardium. It is situated between these 2 layers is the pericardial cavity filled with the serous fluid known as pericardial fluid. The pericardial cavity is not a large cavity. Imagine this. Take a piece of glass, put an eyedropper of water in the center, then take another piece of glass and rest it on top of the first. That's about the size of the cavity and the amount of fluid that it holds. It's only a few milliliters. This fluid is important because it helps reduce friction between the 2 layers as the heart moves when beating. Myocardium is the middle layer of the heart. It is the muscle portion of the heart, the cardiac muscle. It is the thickest layer and forms the bulk of the heart. It is the layer responsible for the pumping action. Remember that cardiac muscle is striated like skeletal, but it is involuntary. The endocardium is the innermost layer of the heart. It is a thin layer of endothelium that lies over the layer of connective tissue. Not only does it cover the valves of the heart, but is continuous with the endothelial lining of blood vessels. The 4 chambers of the heart and septal walls. The upper chambers are called the right and left atria. Atrium means singular. The lower chambers are the right and left ventricles. Septum. This means a wall or partition that divides a body space or cavity. Interatrial septum is the partition or wall that separates the right atrium from the left atrium. Inter means between, and then you have the word atrial for atrium, and septum means wall. The atrioventricular septum separates the atria from the ventricles. This is a general term for separating the upper chambers from the lower chambers without regard to the side of the heart. If we wanted to be more specific as to the side of the heart, all we need to do is put the word right or left in front of the word atrio. Right atrioventricular septum separates the right atrium from the right ventricle. The left atrioventricular septum separates the left atrium from the left ventricle. The interventricular septum is the wall or partition that is located between the right and left ventricles. The valves of the heart. The heart has 4 valves, but let's see what the function is first. The job of the valve is to allow blood to flow in one direction. In other words, it prevents a backflow or regurgitation of blood. They open and close when the heart contracts and relaxes. The tricuspid valve, or right atrioventricular valve, is located between the right atrium and the right ventricle. It gets its name because it has 3 cusps, or flaps. It allows the blood to flow from the right atrium to the right ventricle, but not in the opposite direction. The bicuspid valve, or mitral valve, or left atrioventricular valve, is located between the left atrium and the left ventricle. It gets its name because it has 2 cusps, or flaps, and this allows blood to flow in one direction, from the left atrium to the left ventricle. The pulmonary semilunar valve is found at the orifice or opening of the pulmonary trunk. It allows blood to flow from the right ventricle into the pulmonary trunk, which in turn will deliver blood to the lungs. The aortic semilunar valve is located at the orifice of the aorta. It permits blood to leave the left ventricle and flow into the aorta, and the specific part of the aorta is the ascending aorta. Let's look at the internal anatomy of the heart, and we're going to look at the right atrium. The right atrium receives blood from three veins. The superior vena cava, abbreviated as SVC, returns blood from all areas above the diaphragm. The inferior vena cava, or IVC, returns blood from areas inferior to the diaphragm. The coronary sinus is located in the posterior wall of the right atrium and returns blood from coronary circulation. Systemic circulation, which includes coronary circulation, terminates in this chamber by these three veins. The right atrium contains pectinate muscles. These are muscular ridges that are located in the anterior wall. These ridges run parallel to each other and resemble the teeth in a comb. The fossa ovalis, or ovale, is an oval depression located in the septal wall of the right atrium. This is the remainder of the foramen, or opening, which is called the foramen ovalis, in the fetal heart that normally closes soon after birth. The right ventricle. The right ventricle contains trabeculae carneae, a series of ridges formed by irregular folds of the myocardium. They are located in the anterior wall of the right ventricle. Right ventricle also contains papillary muscles. These are cone-shaped muscles located in the anterior walls of the ventricles that project upward into the lumina, or cavity, of the ventricle. Chordae tendineae. These are fibrous cords that attach the undersurface of the tricuspid valve to the papillary muscles. Deoxygenated blood leaves the right ventricle of the heart via the pulmonary trunk. It will carry this deoxygenated blood to the lungs for reoxygenation. Pulmonary circulation originates from this chamber. The purpose of the chordae tendineae is to keep the flaps of the valves taut. Having hard tried visualizing this? Try this. I'm going to jump out of an airplane. Fat chance, but to help you understand this, I'll do it. Okay, I put the parachute on. The harness is around my body. I'll be the papillary muscle, and I jump. I pull the ripcord, and the chute opens. The parachute resembles the undersurface of the valves. The cords that attach the parachute to the harness, the papillary muscle, simulating the chordae tendineae. These cords keep the parachute nice and taut and allows me to glide through the air very nicely. Now let's say you decide to jump out of the plane with me. You come along with me with a pair of scissors and cut those cords. Well, what happens besides the fact that you will probably fail the class, and because you've killed the instructor, the parachute reverses directions and I fall to the ground at great speed. The same holds true if something would happen to these flaps. If they were loose, we would have a backflow of blood into the right atrium. So we need to keep these flaps taut so the blood flows in one direction only. The left atrium. The left atrium receives oxygenated blood from the lungs through the four pulmonary veins. There are two right pulmonary veins coming from the right lung and two left pulmonary veins coming from the left lung, giving us our four pulmonary veins. Pulmonary circulation terminates in this chamber. The left ventricle. The left ventricle mimics the right ventricle because it also contains trabeculae carneae, papillary muscles, and chordae tendineae. The trabeculae carneae is a series of ridges formed by irregular folds of the myocardium, and they are located in the anterior wall of the left ventricle. The papillary muscles are cone-shaped muscles that are located in the anterior wall of the ventricles that project upward into the lumina, or cavity, of the ventricles. The chordae tendineae are fibrous cords that attach the undersurface of the bicuspid valve to the papillary muscles. Oxygenated blood leaves the left ventricle of the heart via the ascending aorta. Systemic circulation starts in this chamber. The conduction system. So how does the heart beat? It does so by an intrinsic regulatory system composed of 4 specialized cardiac muscle fibers that generate an electrical impulse and distributes them through the cardiac muscle, allowing it to contract. These are autorhythmic fibers. They are self-excitable. The 4 tissues that are involved in the conduction system are as follows. The sinoatrial node, known as the SA node, acts as the pacemaker of the heart. It initiates a cardiac impulse which causes the contraction of both atria. The atrioventricular node, abbreviated AV node, acts as the receiving and transfer station for the cardiac impulse. It picks up the impulse from the SA node and delivers it to the bundles of His. The bundles of His act as a transport for cardiac impulses, carrying down the interventricular septum to the Purkinje fibers. The Purkinje fibers emerge from the bundles of His. The electrical impulse shoot through these fibers until it reaches the apex of the heart, causing both ventricles to contract. In a normal heartbeat, the 2 atria contract as the 2 ventricles relax, and the 2 atria relax as the 2 ventricles contract. The scientific term used for the contraction phase of the cardiac cycle is systole or systole, and the term used for the relaxation phase is referred to diastole or diastole. So each time the ventricles contract, blood leaves the right ventricle by the pulmonary trunk and travels to the lungs, and blood leaves the left ventricle by the aorta and travels throughout the body. As the ventricles are contracting, forcing the blood out of the heart, the atria are relaxing to allow them to fill up with blood. The right atrium receives venous blood via the SVC, IVC, and coronary sinus from all areas of the body except from the lungs. The left atrium is relaxing and receiving oxygenated blood from the lungs by the 4 pulmonary veins.